It's 8:49. Good morning. Well, weed is now legal in Canada, and here in Ontario, you can purchase it online. But will you? That's our CTV Morning Live web poll question for you today. Will you purchase marijuana now that it's legal? And so far, 19% of those who voted said yes. 81% say no. You can have your say by heading to our website at ctvottawamorning.ca. And so we are rejoined by our panel this morning. We have Dr. Paul Roumeliotis, a pediatrician and medical officer of health for Eastern Ontario, Alex Lucifero from Samfiru Tumarkin, managing associate, and Marino Francispillai from Ottawa Public Health and in charge of mental health for the schools in our region. Okay, let's get into some of the questions that our viewers have sent in to us. And let's start with this first question that's come in. Can someone overdose on cannabis? A very good question. Dr. Paul, let's put that one to you.
Yes, excellent question, and the answer is yes, they can. As a matter of fact, the signs of overdose really are, fortunately, the good news is that they're usually not fatal, and unlike opioids and so on, but there are overdoses, and there have been experiences in the United States with children getting into it and people smoking a lot of it. The symptoms are really high heart rate, agitation, not feeling well, and so on, so requiring hospitalization and supportive treatment. One of the things that I just wanted to say is that the reason a lot of people in the United States overdose is because when you smoke it, you get high in about a minute or two. When you eat it, you get high in about an hour or two. So people, what they used to do is they used to say, oh, the first cookie didn't work, I'll take 3. And they ended up in hospital. So yes, and that's how they overdosed.
Okay, so we have another question that has come in from another viewer. Let's have a look at this one. How long does THC last in my body? Another great question, Dr.
That's
Paul?
a very good question, and that depends because it's twofold. Is it in my body? How long is it? And how long is the effect on my brain? Those are two different issues. So just somebody who's smoking it intermittently or taking it intermittently, vaping it and so on, probably 6 to 8 hours is what we're saying. And so the guidelines are don't drive or operate heavy machinery within that time frame. And it's variable, like alcohol as well. It's quite variable depending on the individuals. Now, where we get a bit tricky, and I don't want to complicate people's lives here, is that people who are on it chronically or for medicinal purposes, they may have it in their blood, but it may not affect them in terms of their ability to concentrate and to drive and so on.
Okay.
But in general, it's 6 to 8 hours.
Okay. Another question that's come in, this one. Would someone please talk about the risks of mixing cannabis use with other drugs and or alcohol? Marino, what do you say to that?
Yeah, you know what, this is a conversation we have with teens all the time, and you know, with prom and things like that, we're telling teens, you know, try to avoid mixing as much as possible because everybody's different and how you react to this stuff is different. And when you're mixing, you're just, you know, it's the roulette, right? You're rolling the dice, and it's better not to mix.
It makes it more dangerous or more potent in some way?
Well, there's more risk of that interaction between them, and a lot of people have different interactions. So there are too many variables, and that's where we're saying, you know, if you're going to use the cannabis, don't mix it. Use it on its own. That reduces your risks.
Okay, let's move on to some more questions. This one coming in, does no smoking in the workplace include cannabis? This a clear question for you, Alex.
Yep, and I think we touched on it head on in our first segment. The answer is no. You cannot smoke or vape marijuana in the workplace. Short and sweet.
Short and sweet. So if it's no smoking, that means no smoking cigarettes, no smoking
Simple
marijuana.
as that. And although the provincial government is introducing legislation that is going to put cigarette smoking and marijuana smoking in the same category. And so what they're proposing is you'll be allowed to smoke marijuana in public places, and there's been some negative feedback to that introduced legislation. So we'll have to wait and see on that issue.
Interesting. Okay.
On that front, we're very lucky because in Ontario and in Canada, we've had a lot of years of working on the smoking issue through tobacco. So the good thing is that on that front, society is at a point where we know we're not wanting to smoke indoors, we're not wanting to smoke in the workplace. We're really trying to avoid those things, and people have accepted that. The hope here is that we continue down that same line and we don't renormalize something that has been denormalized at this point.
Okay.
So I think the whole idea of smoking is one of those things that hopefully we're all on the same page on this and everybody's heading in that same direction. Smoke outside, stay away, know where you can and can't.
Kind of following that same road. One more question, let's take this one in. I work in the construction industry, driving a truck. My company is part of random drug testing. Right now we cannot have any traces of pot in our system. When it's legal, will I be able to smoke on my own time like nights and weekends? Alex, this one for you.
That is a can of worms.
Sounds like it.
Where do we start? I think where I'll start is Number one, as an employer, you have to be extremely careful about drug testing in the workplace. Status quo is that it's not allowed. You cannot infringe on an employee's privacy to that extent. There are exceptions, but those exceptions are few and far between. Those exceptions being if, as an employer, number one, you have employees working in safety-sensitive positions, and number two, have a history of drug problems or drug addiction problems in the past in the workplace, you would likely be allowed to drug test. But, you know, if that's not the case,
and what would,
I think
if
you've got a
I
problem.
can just stop you, what would be those safety sensitive, what fields of work is that? Is that like police, paramedics, doctors?
You name it. I mean, it could range from construction, which is the individual who asked this question mentioned, you know, things like mining, things like anything to do with police officers, aviation.
Nurses?
Nurses, maybe to a lesser extent, but sure. You know, and things along the lines of, you know, public transportation and the like.
Sure.
I mean, those are certainly safety-sensitive positions where you're operating heavy machinery or you're responsible for a large group of people. And in those situations, employers should have a policy that's effectively a zero-tolerance impairment policy.
And it's not too late for those employers to write that into a policy now, even though we've now entered a new era?
We're here. You probably should have done it already as an employer, but it is definitely not too late. Employers should get on that ASAP if they haven't.
Okay, terrific. Thank you so much, gentlemen. We are going to be back with a few more questions in a little bit. If you have any, don't forget to send them our way. And a reminder, CTV News is presenting a very special broadcast today now that cannabis is legal in our country. CTV Ottawa will broadcast live from the Tweed facility in Smiths Falls and have guests on hand to answer a range of questions. That starts tonight at 5. And of course, we want to hear your questions about pot. Send them to ottawanews@ctv.ca or through our social media channels. We'll be answering them again shortly after 9 o'clock. Back right after this.